Have you ever wondered why a pregnant woman might suddenly develop an insatiable desire for pickles dipped in chocolate? While it might seem like a peculiar concoction to the rest of us, these cravings are a common part of the pregnancy experience. Welcome to our exploration of the fascinating science behind pregnancy cravings. Pregnancy cravings, those sudden and intense desires for specific foods, are an intriguing phenomenon that has puzzled scientists and expectant mothers alike for many years. But what exactly causes these cravings? The answer is a complex interplay of hormones, altered senses, and the body's innate desire to obtain certain nutrients. During pregnancy, a woman's body undergoes massive hormonal changes. One of these hormonal shifts involves the hormone human chorionic gonadotropin, or HCG. This hormone, which rises significantly during the first trimester, is believed to be linked to the onset of cravings. In addition to hormonal changes, pregnancy can cause a woman's senses to become heightened. This heightened sensory perception can make certain foods taste and smell more appealing, thus leading to cravings. Moreover, the body has a natural mechanism to signal when it needs certain nutrients. For instance, a craving for oranges or other citrus fruits might indicate a need for more vitamin C. However, it's important to note that not all cravings should be indulged without limit. Some cravings might indicate a nutrient deficiency, while others might simply be the result of hormonal fluctuations. It's crucial to maintain a balanced diet to ensure both the mother and the baby receive the necessary nutrients. So, how can you manage these cravings in a healthy way? It's all about balance and moderation. If you're craving something sweet, try opting for a piece of fruit instead of a candy bar. If you're longing for something salty, consider a handful of nuts rather than a bag of chips. Remember, it's completely normal to give in to your cravings occasionally. The key is to not let them dictate your entire diet. In conclusion, pregnancy cravings are a fascinating mix of hormonal changes, altered senses, and the body's drive to obtain certain nutrients. While they can sometimes seem strange, they are a normal part of pregnancy and can be managed with a balanced diet and moderation. Thank you for joining us on this journey into the science behind pregnancy cravings. It's been a pleasure to delve into this topic with you. Until next time, stay curious, stay informed, and most importantly, stay healthy.